The people were taking one vaccine, that was flu. But this year, people have to take three vaccines. Not only flu, but there is an updated COVID vaccine, and there is a new vaccine that is RSV vaccine. So people have to get vaccinated against three viruses: COVID, flu, and new to the menu is RSV, respiratory syncytial virus. These are all winter viruses, लेकिन RSV जो है ये पहले आ जाता है. Last year जो हमने देखा, we expect a repetition this year also. So we have to take RSV now. So and जो रिकमेंडेशन है FDA CDC जो रिकमेंडेशन देती है कि दैट प्रेग्नेंट लेडीज ऑल्सो कैन टेक RSV, क्योंकि दूसरा जो ग्रुप है विच इज मोर वल्नरेबल सीवियर इन्फेक्शन जिनको होता है, दैट इज चिल्ड्रन, यंग चिल्ड्रन, और उनमें मौतें भी होती है. तो वी डोंट हैव a vaccine against young children. So what recommendations are that pregnant ladies in last trimester, not in first two trimester, 3 months, first three, second three, but recommendation is last 3 months, last trimester पे जितने भी pregnant ladies हैं आजकल, they should get RSV vaccine, so that not only they will protect themselves, but they will protect the babies who are born to them, so that they are protected up to 6 months of age. And those who are young children, उनके लिए vaccine नहीं है, but we have antibodies as a protection now. So there is another tool that is called as RSV antibodies, and we can give it to them and they will be protected. ये जो respiratory तीनों viruses हैं, ये winter viruses हैं. Obviously हमें wait नहीं करना है कि पहले आफत आएगी. So vaccine means what? You are preventing it. So prevention के लिए आपको winter से पहले ये वायरस करनी है, ताकि जब खिजां का महीना आता, by the end of October, and in fact earlier the better, September and October is the best time for all these three viruses, all these three vaccines. So RSV के हवाले से मुझे लगता है पहले ही करो, लेकिन but flu and COVID you can do it together, you can do it by the end of October. और dosage के हवाले से adults above 3 years of age, everybody needs 0.5 ml जो syringe होता है इंजेक्शन बाजार में अवेलेबल. बट जो बिलो 3 years of age हैं उनके लिए हाफ डोज है. अनफॉर्चुनेटली पॉसिबली वी डू नॉट हैव हाफ डोज अवेलेबल. सो व्हाट चिल्ड्रन कैन डू, एक रिकंस्टिट्यूशन वायल जो होती है, अगर काफी सारे बच्चे हैं दे कैन टेक ए वायल, सो वी हैव फ्यू डोजेज इन दैट, सो दे कैन पुट इट. सो बच्चों के हवाले से लेस देन 3 years of age, so they have to get half dose, and about 3 years of age, anybody in the adult age, elderly, they have to get the full dose, that is 0.5. लेकिन फ्लू के हवाले से मैं ये कहना चाहता हूँ, दो इट इज फॉर एवरीवन, बट प्रायोरिटी ग्रुप्स शुड नॉट मिस इट. दैट मीन्स बुजुर्ग लोग, वेरी यंग चिल्ड्रन लेस देन 5 years of age should mandatorily get it. हेल्थ केयर वर्कर्स, बिकॉज इनका ये है, अगर डॉक्टर्स इन्फेक्ट हो गए, दे विल गिव इट टू द पेशेंट्स हु आर मोर वल्नरेबल, क्योंकि सो दैट इज वाई जो प्रायोरिटी ग्रुप है, it should be healthcare workers also, बुजुर्ग लोग, young children, pregnant ladies, क्योंकि flu जो है it becomes severe in pregnant ladies, so they should get it. And those with underlying medical condition, चाहे जिनको hypertension हो, cardiovascular disease हो, diabetes हो, lung disease हो, kidney disease हो, liver disease हो, उनके लिए ये तो करना ही करना है, because अगर उनमें इस flu virus जाता है, it becomes severe and deadly in them only. So there are priority groups, though it is for everybody, but priority groups should not, which I mentioned earlier, they should not miss it. The third vaccine is basically COVID vaccine. तो लोगों ने COVID लिए हैं, मतलब long back. So both have taken 2 doses, some have taken boosters also, but that is long back, I think 1 year back. So COVID vaccine का ये है कि that up to 3 months इसमें antibodies रहते हैं, 4 months after that it starts waning. जो CDC और FDA जो recommendation देते हैं, they have now recommended an updated vaccine, because everybody knows COVID keeps on changing. और इस साल भी अगर आप देखोगे, though it is Omicron variants only, but we have changed viruses every now and then. So now we have variants of Omicron. So जो पहला वैक्सीन था, that was against the original strain, but जो updated वैक्सीन अब बनाया है कई कंपनीज ने, that is specifically against Omicron variants. So which is an updated vaccine. So recommendation ये है कि everybody should take it. So इस साल before the winter, everyone has to take an updated COVID vaccine. इसमें भी है priority groups should not miss it. Elderly, those with underlying medical conditions, and those immunocompromised with cancer also. So they have to be prioritized for this vaccine. So the message would be that people जब भी available होंगे ये vaccines, flu तो है अभी flu vaccine, people should start vaccinating against flu. And जब भी दूसरे vaccines available होंगे, people should vaccinate against COVID and RSV also whenever they become available, so that ये winter हमारे लिए it will be free of these deadly respiratory infections.